Hi, I'm Shannon from the WVU Medicine Center for Joint Replacement, here to talk to you about compression stockings. You will be instructed to wear compression stockings on both legs after your joint replacement surgery. These stockings compress the veins in your legs to help keep swelling down and reduce the chance of developing blood clots. If you are wearing thigh-high stockings, there's an opening in the toe area. It's easier to put the stocking on if you put a plastic bag over your foot, then slide the stocking over the bag and pull it up over your ankle. Remove the bag from your foot. You should wear the stockings on both legs 18 hours a day for 4 weeks. Be sure to notify your orthopedic nurse clinician if you notice increased pain or swelling in either leg.